Okay, so managing diabetes can sometimes feel like, you're just trying to solve a puzzle, but you're missing like half the pieces.
Yeah.
But what if you had a cheat sheet? Well, that's kind of what we're diving into today.
Hmm.
We're talking about the American Diabetes Association's 2025 Standards of Care.
Okay.
And trust me, these are basically like a roadmap to the future
Hmm.
of diabetes management.
Yeah.
And they're jam-packed with some really interesting updates that could honestly change the way you think about your health.
Absolutely.
So big shout out to London HeartbeatsZ Academy in the UK for giving us access to this incredible material. You guys are the best. Make sure you check them out on Facebook, Instagram, Spotify, and YouTube for more awesome deep dives like this.
It is a fascinating look at where diabetes care is heading, that's for sure.
It is. So the first thing that jumped out at me is this whole CGM revolution.
Yep.
Continuous glucose monitors, those little devices that are tracking your blood sugar 24/7.
Right.
I always thought those were just for people with type 1 diabetes.
Yeah, that's a common misconception. The ADA is really pushing for anyone with diabetes to consider using a CGM,
Okay.
even if you're type 2 and not on insulin.
That's interesting. So is this like, would this replace finger pricking? Or is it like in addition to finger pricking?
Well, it depends. For some people, it can replace finger pricking altogether. But for others, they might still need to do some finger pricking, especially if they're using insulin. But the data from the CGM can really help them fine-tune their insulin doses and make sure their blood sugar is staying in a healthy range.
So it's about like adding more data to the picture. Right.
Healthy.
Okay, so let's talk about that data then, because here's where it gets really interesting to me. Imagine having access to not just like the numbers,
Mhm.
but detailed reports and even the raw data from your CGM.
Hmm.
The ADA is really pushing for more standardized CGM reports that can actually help you understand your own personal glucose trends and make more informed decisions about your care.
Yeah, it's really about that personalization. With all that data, you and your healthcare team can fine-tune your treatment plan to be much more precise and effective.
So it's like having a personalized diabetes coach.
Yeah.
But instead of just yelling at you to do burpees, it's giving you like data-driven insights.
Exactly. And this data-driven approach is also reflected in the ADA's perspective on the diabetes landscape in the U.S. as a whole.
Yeah, it is a little bit sobering though, isn't it?
It is.
I mean, diabetes is affecting a huge portion of the population.
Yeah.
But I think what struck me in these guidelines is that the ADA isn't just focused on the numbers. They're really pushing for a more person-centered approach
Right.
and acknowledging that everyone's diabetes journey is different.
It is different. And when we think about that bigger picture, the ADA is also placing a huge emphasis on the social determinants of health.
Okay, so for anyone who's not familiar with that term, like what exactly does that mean?
So social determinants of health, or SDOH, are all those factors outside of medical care that can impact a person's health. Things like access to healthy food, affordable housing, reliable transportation, even things like social support can really play a big role in a person's ability to manage their diabetes.
So it's kind of acknowledging that managing a chronic condition like diabetes isn't just about willpower. It's about actually having the resources and the support to make those healthy choices.
Exactly. And the ADA is calling for strategies that address these social determinants directly, making diabetes care more equitable for everyone. It's a really important shift in perspective, I think.
It is. So speaking of shifting perspectives, let's talk about prevention.
Okay.
Because the ADA guidelines have a lot to say about prediabetes and early diagnosis.
Yeah, early detection is absolutely key.
Mhm.
The guidelines outline specific criteria for diagnosing prediabetes using blood tests like the A1C.
So if you fall into that prediabetes zone, you can actually take steps to prevent or delay the progression to full-blown diabetes.
Absolutely. Lifestyle changes, sometimes medication, it can make a big difference.
That's really empowering. So what about for people who, like, they're not quite in that prediabetes range, but maybe they have some risk factors,
Right.
like family history or, maybe they're overweight. Like, what should those folks be thinking about?
Well, even if you're not in the prediabetes range, it's still important to understand your personal risk factors. Things like family history, weight, lifestyle all play a role.
Mm-hmm.
And it's a good reminder that risk is really a spectrum, not just an on-off switch. Being proactive about your health is never a bad idea.
Is ever a bad idea. Now, the ADA standards also have this really helpful flow chart for determining the type of diabetes you have.
Right.
And it considers factors like age, autoimmune markers, and body weight. Why is that accurate diagnosis so important?
Well, it guides your treatment plan from day one. Knowing if you have type 1 or type 2 diabetes will determine the most effective approach, whether that's lifestyle changes, medication, or a combination of both.
So it's like getting the right map for your specific diabetes journey.
Exactly. And speaking of journeys, let's talk about pregnancy and diabetes. This is a topic that requires some special attention.
I've always been curious about this. What are some of the key things the ADA highlights for pregnant individuals with diabetes?
Well, one of the big things is screening for gestational diabetes. That's the type of diabetes that can develop during pregnancy.
Okay.
They recommend a two-step approach using the oral glucose tolerance test. This test helps identify individuals who might develop diabetes during their pregnancy.
So it's kind of like a safety net, making sure that any potential issues are caught early on.
Exactly. And then they also delve into this fascinating area of automated insulin delivery or AID systems. It's a relatively new technology, but it's showing a lot of promise for managing diabetes during pregnancy, particularly for those with type 1.
So this is like cutting edge stuff.
It is. It's an evolving area, and careful evaluation by your healthcare provider is essential, but it's definitely something to watch.
Yeah, that's pretty amazing. So speaking of taking control of your health, let's move on to lifestyle management.
Okay.
Because it's not just about medication, right?
Absolutely not. The ADA is a huge advocate for lifestyle changes as a powerful tool for managing diabetes. They emphasize nutrition, physical activity, even behavioral therapy.
So it's a holistic approach, acknowledging that food, movement, and our mental well-being are all interconnected.
Exactly. It's about personalized meal planning, strategies for managing stress and diabetes distress, and creating sustainable, healthy habits that you can stick with.
It's about empowering yourself to be an active participant in your health.
Precisely. And speaking of taking an active role, let's explore the world of medications. The ADA provides a pretty comprehensive overview of the options available.
Okay, so this is where it can get a little overwhelming, right?
It can be.
There's so many different medications out there.
There are.
But the ADA guidelines do a good job of breaking down the different classes of medications like insulin, GLP-1 receptor agonists, and SGLT2 inhibitors, and explaining how they work.
Right, they give you a good overview.
So it's not just about knowing the names of the drugs, it's about understanding how they actually work in your body and what their potential benefits and risks are.
That's the key. And they also emphasize the importance of de-intensifying medication when appropriate, especially in older adults where the risks might outweigh the benefits.
So it's about finding that sweet spot, like effective treatment without unnecessary medication burden.
Exactly. And speaking of older adults, the ADA dedicates a whole section to their specific needs, recognizing that aging comes with its own set of challenges when it comes to managing diabetes.
So what are some of the key takeaways for older adults with diabetes?
One of the big things is the need for individualized glycemic goals. What's appropriate for a younger person might not be the best target for an older adult.
So again, it's about tailoring treatment to the individual circumstances and health status.
Exactly. They also highlight medication safety, making sure the medications are appropriate and won't interact negatively with other drugs the person might be taking. Polypharmacy can be a big issue as we age.
It's like a juggling act, keeping track of all those pills.
It can be. And that's why close communication with your healthcare provider is so important.
Now, the ADA also acknowledges the growing population of older adults with type 1 diabetes.
They do. They highlight the unique challenges this group faces. Managing type 1 diabetes as you age can require some adjustments to your care plan.
It's a reminder that diabetes care is a lifelong journey, and the support and resources you need may evolve over time.
Couldn't agree more. And that brings us to another important group, youth and diabetes. Managing diabetes in children and adolescents requires a specialized approach.
Yeah, kids are still growing and developing, so their needs are very different from adults.
Exactly. The ADA provides specific recommendations for youth with both type 1 and type 2 diabetes, focusing on everything from lifestyle management to pharmacotherapy.
So let's start with type 1. What are some of the key considerations for young people with this type of diabetes?
Well, one of the biggest challenges I imagine is that, their bodies are still growing and changing.
Which can make blood sugar control a bit of a moving target.
Absolutely. And the ADA really emphasizes the importance of individualized insulin regimens and frequent blood sugar monitoring,
Okay.
especially during growth spurts and puberty. They also recommend continuous glucose monitoring, or CGM, whenever possible to get a more complete picture of how their blood sugar is fluctuating throughout the day.
So it's kind of like almost more important for kids in a way because you don't know how their bodies are going to react.
Right. It gives them that more information to work with.
Yeah. CGMs are pretty amazing, though, aren't they? It's like having a window into your body's inner workings.
They really are. And for kids who are active in sports or other physical activities, they can be lifesavers. The ADA guidelines offer specific advice on how to adjust insulin doses and carbohydrate intake to prevent hypoglycemia during exercise.
So it's all about finding that balance right.
Yeah,
Letting kids be kids while also keeping their blood sugar levels safe.
exactly. And speaking of finding balance, let's talk about the unique challenges of managing diabetes in school settings.
Yeah, I imagine that can be tricky for kids. Like, how do you even begin to navigate that?
It can be tricky. The ADA really emphasizes the importance of open communication and collaboration between parents, school staff, and the child's healthcare team.
Yeah.
They recommend developing a detailed diabetes medical management plan, or DMMP, that outlines the child's specific needs and how to handle various situations like hypoglycemia or hyperglycemia.
So it's like a roadmap for the school to ensure the child's safety and well-being.
Precisely. Now let's shift gears and talk about youth with type 2 diabetes.
Okay, so what are some of the key things the ADA highlights for this group?
Well, one of the most important things is early intervention. The guidelines recommend screening all children with overweight or obesity who have at least one additional risk factor for type 2 diabetes, such as a family history of the disease. The idea is to catch it early when lifestyle changes can still make a big difference.
So it's about prevention, right? Stopping it in its tracks before it progresses.
Exactly. And speaking of prevention, the ADA guidelines have a whole section on lifestyle management for youth with type 2 diabetes. They emphasize things like creating a healthy eating plan, incorporating regular physical activity into their routine, and addressing any emotional or behavioral issues that might be contributing to unhealthy habits.
So it's, again, like a holistic approach, looking at the whole picture.
It is, and it's important to remember that kids need support and encouragement, not judgment or shame. The ADA emphasizes the importance of creating a positive and supportive environment for youth with type 2 diabetes.
It's about working together as a family with the healthcare team to make healthy choices fun and sustainable.
Exactly. Now, moving on to a more specific type of diabetes, the guidelines also address something called post-pancreatitis diabetes.
Okay, I'm not familiar with that one. What is post-pancreatitis diabetes?
So it's a type of diabetes that can develop after a person has had pancreatitis, which is inflammation of the pancreas. The pancreas is the organ that produces insulin, so when it's damaged, it can lead to diabetes.
That makes sense. So how do they recommend managing this type of diabetes?
Well, the guidelines acknowledge that it can be quite challenging to manage, as it often involves both insulin deficiency and insulin resistance.
Okay.
They recommend a personalized approach that includes lifestyle changes, blood sugar monitoring, and often insulin therapy.
So it's about tailoring the treatment to the individual's specific needs, which is kind of like the theme of all of this.
Exactly. And they also mention a procedure called islet autotransplantation as a potential option for some individuals.
Islet autotransplantation, what is that?
It's a pretty amazing procedure. It involves taking insulin-producing cells from the patient's own pancreas and transplanting them into the liver. This can help reduce or eliminate the need for insulin injections.
Wow, that's incredible. Science is constantly pushing the boundaries.
It really is. And speaking of pushing boundaries, the guidelines also shed light on the connection between diabetes and bone health.
I don't think I've ever really thought about those two being connected.
It's not something people always associate with diabetes, but the ADA highlights that individuals with diabetes are at increased risk of fractures.
Really? Why is that?
Well, diabetes can affect bone mineral density, making the bones weaker and more susceptible to breaks.
Huh.
And certain medications used to treat diabetes can also increase the risk of fractures.
That's important information to know.
Oh.
So what can be done to protect bone health?
The guidelines recommend regular bone density screenings for people with diabetes and early intervention with lifestyle changes or medications if bone loss is detected.
So again, it's all about being proactive and taking a holistic approach to your health.
Exactly. And another important aspect of proactive care that the guidelines address is immunizations.
Right, because immunizations are crucial for everyone, but especially for individuals with chronic conditions like diabetes.
Absolutely. The ADA guidelines provide specific recommendations for which vaccines people with diabetes should get, including the flu vaccine, the pneumococcal vaccine, the hepatitis B vaccine, and the shingles vaccine. These vaccines help protect against infections that can be more serious for people with diabetes.
It's all about building up your defenses, right?
Precisely. And on that note, let's shift our focus to diabetes self-management.
Okay, so this is where the rubber meets the road, right?
hmm
It's all about empowering individuals to take control of their own health.
It is. And the ADA has a whole section dedicated to self-management education and support, or DSMEs. They recommend that everyone with diabetes, regardless of type or stage, participate in a structured DSMES program to gain the knowledge and skills they need to manage their condition effectively.
So what does a DSMES program typically involve?
It covers a wide range of topics, from blood sugar monitoring and medication management to healthy eating, physical activity, and coping with the emotional challenges of living with diabetes. It's like a comprehensive toolkit for navigating life with diabetes.
That sounds incredibly helpful. So is this like a one-time thing, or is this something that you do kind of like on an ongoing basis?
The ADA recommends participating in DSMES at various points in your diabetes journey. After diagnosis, annually, or whenever you're facing new challenges or not meeting your treatment goals.
So it's about ongoing support and guidance, not just a one-time thing.
Exactly. And beyond DSMES, the ADA highlights the importance of setting realistic goals, developing a personalized meal plan, establishing a regular exercise routine, and finding healthy ways to cope with stress.
It's all about making healthy choices part of your daily life.
It is. And thankfully, technology is playing an increasingly important role in diabetes self-management, offering a wealth of tools and resources.
Oh, absolutely. I mean, we've got CGMs, insulin pumps, and all these smartphone apps that can track blood sugar, medications, and other important metrics. It's amazing how much technology can empower us to take control of our health these days.
It really is. And the ADA encourages the use of these technologies as part of a comprehensive self-management plan.
Now, the ADA standards also acknowledge the psychological side of diabetes,
Yeah.
which is something we don't always talk about enough.
They do. They highlight the importance of screening for and addressing diabetes distress. That feeling of burnout and emotional burden that can come with managing a chronic condition like diabetes.
Diabetes distress is real, isn't it?
Yeah.
It's that constant worry, the guilt, the feeling of being different.
It can be incredibly challenging. And the guidelines encourage healthcare providers to be sensitive to this and offer support and resources like behavioral therapy or support groups to help people cope.
It's about normalizing those feelings and letting people know they're not alone in their struggles.
Exactly. And on a similar note, the ADA emphasizes the importance of addressing stigma and discrimination related to diabetes.
Yeah, stigma can be so harmful, making people feel ashamed or judged for having a condition they can't control.
It can. And the ADA guidelines call for healthcare providers to be mindful of their own biases and to create a welcoming and supportive environment for all people with diabetes.
It's about treating everyone with respect and understanding, recognizing that everyone's diabetes journey is unique.
Couldn't agree more. Now, as we wrap up this part of our deep dive into the ADA standards of care for 2025, I think it's clear that these guidelines offer a really comprehensive and forward-thinking approach to diabetes management.
It's an exciting time to be living with diabetes, with so many advances in technology and treatment, but it's also crucial to remember that knowledge is power.
Absolutely. These guidelines are a valuable resource for anyone with diabetes. But it's crucial to work closely with your healthcare provider to develop a personalized plan that meets your individual needs and goals.
Shared decision-making and personalized care are key. And remember, you're not alone on this journey. There are countless resources available to support you, from healthcare professionals to diabetes educators to online communities.
Exactly. And don't forget to check out London HeartbeatsZ Academy for more insightful discussions on health and well-being. You can find them on Facebook, Instagram, Spotify, and YouTube.
Thanks for joining us on this deep dive into the ADA Standards of Care for 2025. We hope you found it informative and empowering. Until next time, stay curious and take good care of yourself.
It really is. It's about empowering individuals to take charge of their own well-being.
And speaking of empowerment, one thing that really struck me in these guidelines is the emphasis on patient-centered care.
Absolutely. This goes beyond simply following a prescribed treatment plan.
Mhm.
It's about fostering a true partnership between the person with diabetes and their healthcare provider.
So it's about shared decision-making, right?
Exactly.
Making sure that the individual's values and preferences, and even like their lifestyle, are all taken into consideration when developing a care plan.
Exactly. The guidelines really highlight the importance of open communication, active listening, and respecting the individual's autonomy when it comes to making decisions about their health.
This whole shift toward patient-centered care is Really transformative, isn't it? It puts the individual kind of in the driver's seat, so to speak.
It does, and it recognizes that managing diabetes isn't just about, numbers and medications.
Right.
It's about understanding the person behind those numbers and tailoring care to meet their unique needs.
Yeah, speaking of individual needs, I know the ADA guidelines also address the importance of culturally sensitive care. Can you talk a little about that?
Of course. Recognizing and respecting cultural differences is really crucial in diabetes care.
Hmm.
Different cultures have unique beliefs and practices and attitudes towards health and illness.
Right.
And these factors can really influence how people perceive and manage their diabetes.
So it's about being aware of those
Mhm.
differences and tailoring care accordingly.
Precisely. The guidelines encourage healthcare providers to be culturally competent,
Uh,
meaning that they have the knowledge, the skills, and the attitudes necessary to provide care that is sensitive to the individual's cultural background.
So that might involve things like understanding dietary preferences or traditional healing practices, or even communication styles, right? Yeah.
Exactly. It's about creating a welcoming and inclusive environment where individuals feel comfortable sharing their perspectives and asking questions.
It's about meeting people where they are, both, like literally and figuratively.
Couldn't agree more. So let's shift gears a little bit and talk about some of the technological advancements that are shaping the future of diabetes care. We've already talked about CGMs and insulin pumps, but there's so much more happening in this space.
Oh yeah, it seems like there's a new diabetes app or device launching every day. Like, how do you even keep up with it all?
It is a rapidly evolving field, and the ADA guidelines recognize the potential of technology to improve diabetes management. They talk about things like telemedicine, which allows people to connect with their healthcare providers remotely, and even artificial intelligence, which is being used to develop algorithms that can predict blood sugar fluctuations and personalize insulin dosing.
Wow, that's pretty amazing. It's like having a virtual diabetes coach at your fingertips.
It is, and these advancements are not only making diabetes care more convenient, but they're also helping individuals take a more active role in their own management.
So it's about empowering people to make more informed decisions about their health.
Exactly. And as technology continues to evolve, we can expect to see even more innovative tools and resources that will really transform diabetes care.
It's an exciting time to be living with diabetes, that's for sure.
It is. And as we wrap up our deep dive into the ADA standards of care for 2025, I think it's important to emphasize that these guidelines are a living document.
Hmm.
They're constantly evolving as new research emerges and technology advances.
So it's not just about memorizing a set of rules, it's about staying informed and engaged in your care.
Exactly. And remember, these guidelines are just a starting point. The most important thing is to work closely with your healthcare provider to develop a personalized plan that meets your individual needs and goals.
It's about that collaborative partnership, finding what works best for you and for your, unique circumstances.
Couldn't agree more. And if you're looking for more in-depth information and resources on diabetes care, be sure to check out London HeartbeatsZ Academy. They offer a wealth of educational materials and insights on their website and social media channels. You can find them on Facebook, Instagram, Spotify, and YouTube.
A big thanks again to London HeartbeatsZ Academy for providing us with this incredible material for this deep dive. You guys are doing amazing work.
Absolutely. Their dedication to diabetes education and support is truly commendable.
Well, that's all the time we have for today's deep dive into the ADA's 2025 Standards of Care. We hope you found this exploration informative and empowering. Remember, knowledge is power, and by staying informed and engaged, you can take control of your health and live a full and vibrant life with diabetes. Thanks for listening, and until next time, take care.